Thanks for joining the Alleghany Journal for an important discussion on potential student violence and how to prevent situations like what happened at the Rivermont School on September 9th. On my far left, is Sheriff Kevin Hall of Alleghany County, Superintendent of Alleghany County Schools, Eugene Catalka, Stephen DeMarzo, a counselor with Alleghany Highlands Community Services, and Stephanie Hepler, a former crisis counselor. Now, both of them are working with crisis situations and have long experience in dealing with this. And we're merely having a discussion in here to help parents who may see some early signs of trouble within their household and what to do. So Stephanie, if I have a student, if I have a child that I detect is having some mental issues, may end up in a potential violent situation, what are the first steps that I need to take as a parent?
The first steps you would need to take as anybody would be to make sure that everyone, including the individual, is safe. And that may mean getting a hold of the local police department and making sure that that person is safe at the moment. We do offer classes to be able for anyone to be able to recognize a mental health crisis and the steps that you can take depending on what the crisis is.
Now, are there patterns when you study this and you learn how to deal with these situations? Are there recognizable patterns that parents may be apprised of that, and you say, hey, I recognize that this might be a future issue?
Not always. Everybody is so individualized, and every diagnosis is so individualized. You can take two different individuals with the same diagnosis, and they both could present very differently. So it is just something that you need to be aware of the person you're around and look at their history and what presents at the time. And
Stephen, when a parent first sees there may be some issues, can you give us a feel for what's the steps that they need to take? They give you a call, set up an appointment. What's the best route to follow?
Well, the Community Service Board has lots of opportunity for people to reach out for multiple services. We offer multiple services. There's not only the mental health clinic that they can call directly. There's open access through the mental health clinic, which allows individuals to walk into the clinic to ask for services and be seen by not only therapists, but then, we have case managers there. And then there's also the emergency after hours number. So, after 5 p.m. when the clinic closes, there is an after hours number that someone can call in an emergency or crisis situation. And at that point, they would actually be in contact with an emergency services clinician who would respond back and speak with them, whether it's a parent or the individual who is in need or in crisis at that point in time. And the CIT site is now open, which is a crisis intervention team site.
That's really a neat concept.
It is, and that's in correlation with the sheriff's department and local law enforcement. And that site specifically currently is run for emergency services that are brought in by the police. So,
what about confidentiality? I mean, some parents probably are worried about a stigma being associated with contacting CSB.
Well, stigma is associated with mental health in general in our society, in our communities, rural areas. I mean, this is why we promote programs like mental health first aid and assist, because what they do is they educate entire communities, they educate schools. It provides such an opportunity for teachers and individuals, parents specifically as well, anyone in the community to come out and learn about mental health, about substance use, about, identifying certain things. So the stigma associated with, making contact first is ongoing. It's throughout our entire country.
But it is a confidential process?
Absolutely. Confidentiality is highly involved in everything that you do when it comes to not only counseling, but even in the medical field. I mean, look, there's confidentiality involved as well.
Okay. And Gene, with respect to the county schools and schools in general, this issue is being watched all over the nation. And you've mentioned it at school board meetings about your concern for safety. You have 3 new school resource officers, or maybe even more. What is Alleghany County Schools doing to serve as the best possible, well, not a backstop, but you're concerned about the issue. How do schools deal with a student who is showing some initial signs of potential violence?
Well, a couple of years ago, we hired a mental health counselor for our school division, and depending on what the symptoms the student may be exhibiting, our mental health counselor will probably provide the first avenue of evaluating the student. At some point, though, we will contact CSB and make a referral. We look at the warning signs. We have trained our staff, students that withdraw, students that show different symptoms, constant anger, a multitude of areas that we'll look at, and at that point then we make an evaluation. But if we have any kind of thought of that the student may be in a mental health crisis, we're going to go ahead and make that immediate referral. And we work very well together with CSB and DSS to help our students. And it's a double-edged, because we have to worry about safety, but we also have to worry about the student to get the student the assistance and help that they need.
And confidentiality is also involved in teacher training as well, to recognize at least some of the initial signs.
Absolutely, and we train all our staff, our bus drivers and our food service employees and our maintenance and custodians, because they may notice something. I can go back several years ago where one of our food services employee in another division I worked in noticed the students constantly sitting at the cafeteria by themselves, and our food service employee made contact with that student, and a couple days later referred that student to us, and we were able to work with that student. And so it's important that everybody's trained and everybody knows to recognize the early warning signs that students and adults can exhibit at the time, and get them the mental health. I think you said first aid, which is a great terminology for that, to provide the assistance.
Sheriff Hall, you were at the forefront of trying to get the money, the funds for school resource officers, which has become an increasingly important thing, not just here, but all across the nation. We wonder, do parents understand, the average parent, do they understand the severity of school threats from any of their children, and what can happen as a result? The long legal process, there is stigma once you've committed an act.
I believe they do. I think last year, after what we went through last year a couple times in our school system, working with them and the Board of Supervisors, that we had tried before, but I think I really give kudos to them that when we had a couple incidents early last year, they stepped up to the plate, gave me a call and said, hey, we need to sit down and talk about providing school resource officers in all our schools. And our resource officers work well with all the staff, the administration, the teachers, and the counselors at those staffs, and they're really into. They know what's going on in their schools. They have a pulse for what's going on, and the parents have been real supportive of all of our efforts.
And Stephanie, is it true that this this problem is not just in a very small manner here an issue, but is this increasingly a problem across the nation? And if so, why? When we were kids, of course, we're talking about decades ago, I don't recall this being an issue. There were a lot of rifles in the homes and hunting and all that kind of thing, and yet this seems to be, the incidents nationwide seems to have increased.
Yes, according to the media too, which I keep up with pretty good, there are lots of these episodes that are going on. It doesn't matter where they are. It doesn't matter if it's a small town, a big city. It doesn't matter if it's a private school, if it's a public school. They just seem to be increasing everywhere. As to why, I think there's been no real connection between any of them. They all just have such random reasons. Sometimes it's internal, sometimes it's external. And that's one of the things that you definitely have to consider. Sometimes people think of the crisis situations as the ones that are screaming in your face, but sometimes those are just the external ones, and there's still those internal reasons that people do the things they do. And sometimes after evaluations we can find out why, and sometimes we can't.
You know, it's odd. We'll hear this on the news, being part of the media, and we often hear the loner kind of thing, as Gene has mentioned. And Gene, with respect to teacher training, you normally think of teacher training in the special sessions you have. Okay, let's learn more about ABCs. But the teacher's role may have been a little more expanded than when we were kids.
It has, and we talk a lot about social emotional learning. Before a student can really learn, they need to have that social emotional background that's pretty solid. And so that comes part of the learning process that we work with our staff. It is different. Who would have thought 20 years ago that we'd have to do lockdown drills and different safety drills, but yet we need to do what's important to ensure that our students and staff are safe in the buildings. And so we'll continue to do those trainings that we need to do, and the right thing to do to make sure that our staff and students are safe. Working with Sheriff Hall and other law enforcement and CSB and DSS together as a team, and we if you hear it, report it, pay attention to it, look at the signals, and don't assume that everything's okay. Take the time to ask, and when in doubt, then contact mental health services.
Sheriff Hall, could you briefly tell the public a little bit more about this crisis intervention center? This is a relatively new concept to Alleghany County, which has just been funded as a result of the CSB's grant applications. This is a way to not sidestep, but it's a process that you can speak with people who are troubled prior to having them locked up. It's kind of like a step such that if the stigma of being arrested and hauled off to jail is one thing, having a good talking to and get the straight facts to them beforehand, or is it more involved than that?
Well, the crisis intervention site was a 3-year project that all of our local law enforcement, we met for 3 years, and with the CSB, and every month, meeting after meeting. Eventually, we were able to obtain a grant for $500,000 to be able to staff that with officers and clinicians and screeners, and it's a way to. What it really does, it helps law enforcement in the idea that our site is open during our busiest times. Is over the years when CSB gives us our busiest times is Wednesday through Sunday from 4 to 12. And this is only for law enforcement people when they bring someone in under an emergency custody order, and then they come in and are pre-screened to see if there's going to be a temporary detention order to be able to transport that someone that's in a mental crisis that needs help.
And there's somebody there qualified like this pair to talk to these people and to try to understand the issues.
Right. Officer will bring them in, out on patrol, and the biggest reward is getting those people that access, immediate access, but it's also getting the law enforcement officer back out on the road and turning them over for a safe transfer into these specially trained officers that have been through the CIT training. And our agency has had 75% of our officers have been through the CIT training, and we have already, and we have a couple more part of this grant. We have 2 set up this fall that hopefully we'll be able to reach the 100% mark and have all our people trained to be able to deal with this.
Well, we thank all 4 of you for joining us today. I think a summary would be this as a parent: if you see something, say something, speak up. The good part about it is it will be confidential. You'll have quality, smart, well-trained individuals to deal with you. You can contact the Community Services Board. If you go through the schools, Mr. Katalka and his staff will work with you, Sheriff Hall and his staff. So there's many avenues to help you solve what you think is a problem. And even if you think it's a problem, you're not sure, these people are well qualified to help you make that assessment. And we thank you all very much for joining us today.
Thank you.
Thank you, Jerry.